You've been doing everything right. You're taking your blood pressure medication exactly when the doctor told you to. You're watching your salt intake, and you're trying to stay active. But despite all that effort, you still feel that nagging uncertainty. Like your body is a car that just won't run smoothly no matter how much maintenance you put into it. Here is a reality check that most people over 60 never hear from their primary physician. The medication itself is only half the equation. The other half is what you choose to take alongside it. We often think of our daily prescriptions as independent variables, like a light switch that is either on or off. But your blood pressure pills are constantly interacting with the chemistry of your body. When you add other supplements, over-the-counter remedies, or even certain common foods to the mix, you aren't just adding health. You are potentially creating a chemical conflict inside your arteries. In this video, I'm going to reveal the 4 things I, as a doctor, would never take if I were on blood pressure medication. These aren't just be careful warnings. These are specific, scientifically documented triggers that can cause your blood pressure to spike, plummet, or simply render your medication completely useless. I'm talking about common household items that are likely sitting in your medicine cabinet or kitchen pantry right now. Some of them sound healthy. Some of them are marketed as natural. And all of them can turn a manageable condition into a sudden, silent emergency. If you've ever wondered why your blood pressure numbers fluctuate despite your strict routine, you aren't just imagining it. There is a mechanism at play here that nobody explains to you in a 5-minute office visit. Stay with me, because by the end of this, you'll know exactly how to protect your results and your peace of mind. When we talk about blood pressure, we tend to visualize a simple plumbing system. You have a pump, the heart, and pipes, the arteries, and a regulator, the medication. We assume that if we keep the pump steady and the pipes clear, everything will function predictably. But the human body isn't a kitchen sink. It is a complex, responsive biological laboratory. Every time you swallow a tablet, you are introducing a compound that is designed to interact with specific receptors in your cells. It changes the way your kidneys process salt, the way your blood vessels relax, or the way your heart responds to signals. Now here's where the problem starts. Most medications are tested and approved based on how they work in isolation. But in the real world, no one lives in isolation. You have aches, you have seasonal allergies, you have digestive concerns, and you have days where you just don't feel like yourself. So, you reach for that bottle on the counter. You take a herbal tea for sleep, an anti-inflammatory for a stiff knee, or a decongestant for a stuffy nose. You think, this is just a little extra help. But to your blood pressure medication, that little extra is an intruder. Before we dive into these 4 specific triggers, I want to know who is watching. Drop your city, state, or country in the comments section below. When I see where people are watching from, it helps me understand the common environment and health habits of this community. And it honestly helps me tailor how I explain these complex interactions. I read every one of them, and I appreciate you taking the time to share. Now I want you to lean in, because understanding these interactions is not about living in fear or throwing away your medicine cabinet. It is about becoming an educated advocate for your own health. You have spent years building a life. Don't let a simple, avoidable interaction undo all that progress. We are going to look at why these specific things cause such a volatile reaction in your circulatory system, starting with the ones that feel the most harmless. Let me tell you about a patient of mine. Let's call him Arthur. Arthur was 68, a retired mechanic who took pride in his precision. He was the kind of man who logged his blood pressure readings in a small leather notebook every single morning at 7 a.m. sharp. For 2 years, his numbers were textbook, perfectly controlled, completely stable. Then, one autumn, he started having some minor joint pain in his hands. It wasn't debilitating, just a dull, persistent ache that made gripping his morning coffee cup uncomfortable. He didn't want to bother me with minor aches, so he did what millions of Americans do. He walked into his local pharmacy, looked at the wall of colorful boxes, and picked up a bottle of a popular, over-the-counter pain reliever. He didn't think twice about it. He took it as directed, 2 tablets twice a day. He wasn't skipping his blood pressure meds. He wasn't eating anything strange. He was doing everything right. 3 weeks later, Arthur came into my office for a routine checkup. As I looked at his notebook, the hair on the back of my neck stood up. The numbers had climbed steadily, first by 10 points, then by 20. By the 3rd week, he was consistently hitting levels that put him at significant risk for a cardiac event. Arthur looked at me, genuinely confused. "Doctor, I haven't changed a thing," he insisted. And in his mind, he hadn't changed his diet or his exercise. He didn't realize that the harmless pain reliever he'd started taking was actively fighting against the mechanism of his blood pressure medication. One was trying to keep his vessels relaxed. The other was telling his kidneys to hold on to salt and water, effectively tightening those same vessels. The result was a tug-of-war happening inside his arteries that he couldn't feel, couldn't see, and couldn't explain. Arthur's story is not unique. It is a cautionary tale about the invisible interactions. It shows us that when you are on blood pressure medication, your body's internal chemistry is a delicate, calibrated system. Introducing a new variable, no matter how small or common, can shift that balance in ways that are immediate and often dangerous. It's not just about the medicine you take, it's about the synergy of everything you put into your system. Now that we understand how these hidden interactions occur, we need to address the first two items on my never list. These are items that seem like pillars of health for many seniors, yet they are frequent offenders in blood pressure destabilization. The first is high-dose licorice root. Now, I'm not talking about the occasional candy piece. I'm talking about the herbal supplements or concentrated teas that many people use to soothe digestive issues or support adrenal health. Natural licorice contains a compound called glycyrrhizin. When you ingest this regularly, it mimics a hormone in your body called aldosterone. In a healthy person, this might just cause a minor shift. But in someone already taking medication to control their blood pressure, it acts like a signal to your kidneys to dump potassium and hoard sodium. Why does this matter? Because many blood pressure medications, particularly ACE inhibitors, work by helping your body manage that exact electrolyte balance. When you introduce licorice root, you are effectively overriding the off switch your medication is trying to press. Your blood vessels tighten, your fluid volume increases, and your pressure numbers begin to climb. The dangerous part? Because it's an all-natural supplement, most people don't even think to mention it to their doctor. The second item on my list is the class of non-steroidal anti-inflammatory drugs, NSAIDs, specifically ibuprofen and naproxen. This is exactly what tripped up my patient Arthur. These are incredibly effective for temporary aches and pains, but they come with a hidden, high-stakes price for your circulatory system. NSAIDs work by inhibiting enzymes that help maintain the integrity of your blood flow in the kidneys. By doing this, they can significantly reduce the efficacy of almost every major category of blood pressure medication, including diuretics and beta blockers. When you take these daily, you aren't just treating pain. You are systematically reducing the ability of your medication to perform its primary job. Most people over 60 have some form of joint discomfort, and the temptation to pop a pill for relief is overwhelming. But if you are on blood pressure medication, every time you reach for that bottle of ibuprofen, you are creating a direct conflict. The medication is trying to lower your pressure, and the NSAID is trying to raise it. It is a biological contradiction that leaves your heart doing unnecessary overtime, and your arteries bearing the brunt of the pressure. I want you to stop for a second and really think about this. Most of us go through our lives assuming that if we are taking our prescribed medication, we are safe. We treat the pill as a shield. But what if I told you that the biggest risk to your health isn't the medicine failing, but the environment you're building around it? Think about the way we view our health after 60. We are told to supplement, to optimize, to soothe, and to fix. We are bombarded with advertisements for natural boosters and quick-fix solutions for every ache and fatigue. We have been conditioned to believe that adding more to our routine is always better. But here is the belief-breaking truth. In the world of cardiovascular health, more is often the enemy. Every single time you add a new supplement, a new heart-healthy tea, or an over-the-counter remedy to your daily intake without checking it against your blood pressure protocol, you are effectively introducing a new, unverified variable into a high-stakes equation. You aren't building a better defense, you are cluttering your chemistry. Most seniors I speak to are terrified of their medication stopping. They fear a stroke or a heart attack. But they aren't worried about the subtle, slow-acting interactions they are choosing for themselves every single morning. That is where the real danger lives. It isn't a dramatic, sudden wall that you hit. It is a slow, steady erosion of your progress. It's like trying to fill a bucket with a hole in the bottom. You keep pouring in more effort, more meds, more vitamins, wondering why the level never rises. It's time to rethink what being proactive actually means. It isn't just about what you add, it's about what you stop doing. We have covered the supplements and the over-the-counter painkillers, but we need to talk about something even closer to home: your kitchen pantry. We often focus so heavily on avoiding salt that we overlook other dietary choices that interfere with blood pressure medications. The third item on my list is something many consider a superfood or a healthy staple: grapefruit and certain citrus hybrids. Now, you might have heard this warning before, but do you actually understand the why behind it? It isn't just a suggestion, it's a clinical interaction. Grapefruit contains compounds called furanocoumarins. These compounds inhibit an enzyme in your small intestine called CYP3A4. This enzyme is responsible for breaking down a wide variety of medications, including several common types of blood pressure drugs, such as certain calcium channel blockers. When you eat grapefruit or drink its juice, you are essentially disarming this enzyme. The result? Your body cannot break down the medication at the speed it was designed to. The drug builds up in your bloodstream to concentrations far higher than your doctor intended. Think of it this way. If your medication is a car that is supposed to travel at 60 miles per hour to keep you safe, grapefruit can suddenly cause that car to accelerate to 90 or 100 miles per hour. You aren't getting a stronger effect, you are getting a toxic dose. This can lead to a sudden, dangerous drop in blood pressure, dizziness, a racing heart, or even fainting. And because this is a food, not a pill, people often drink a glass of juice with their morning meds without a second thought, completely unaware that they are essentially taking a double or triple dose of their prescription. The challenge here is that this interaction is not limited to just one specific drug. It affects a broad spectrum of medications used by millions of seniors. And here is the kicker. The effect of a single glass of juice can last for up to 24 hours or even longer. You cannot simply space out your breakfast and your medicine to avoid it. If you are taking medication for blood pressure, the safest clinical advice is to remove grapefruit entirely from your diet. It feels counterintuitive to label a fruit as dangerous, but when you are managing cardiovascular health, your diet must be as carefully considered as your prescription. Understanding these dietary paradoxes is how you take control of your numbers and stop the mysterious fluctuations that leave you wondering what you did wrong. It is easy to look at these warnings and think, is this really that common? Or, surely my doctor would have mentioned this if it were a major issue. To answer that, we have to look at the cold, hard data. A recent comprehensive review published in the Journal of the American College of Cardiology examined the prevalence of drug-nutrient and drug-drug interactions among older adults. The findings were sobering. The study revealed that nearly 50% of patients taking antihypertensive medications were simultaneously using at least one other substance, whether a supplement, an over-the-counter medication, or a dietary product, known to have a clinically significant interaction with their prescription. What the researchers found most alarming was the clinical drift. Patients weren't just experiencing minor side effects, they were experiencing measurable, sustained instability in their blood pressure readings. The study highlighted that for those taking ACE inhibitors or calcium channel blockers, the unauthorized use of NSAIDs was the single largest contributor to treatment-resistant hypertension. Essentially, these patients weren't failing their medication. Their medication was being systematically undermined by the very things they thought were helping them. The researchers used the term pharmacological interference to describe this. It isn't just a matter of the drug being less effective. It is a matter of the drug's metabolic pathway being blocked, altered, or overwhelmed. The data is clear. The safety and efficacy of your blood pressure management rely on a clean metabolic environment. When you introduce compounds that compete for the same enzymes or alter electrolyte excretion, you aren't just adding a minor variable. You are fundamentally changing the dose and the duration of the medication circulating in your body. This isn't theory. This is the reality of how these drugs behave in the human body. When you understand that these interactions are documented, researched, and verified, you stop looking at your blood pressure fluctuations as a mysterious bad streak and start seeing them as a logical outcome of the chemical choices you are making every single day. We've arrived at the fourth and final risk on my list, and this one is perhaps the most deceptive because it is often tied to the very lifestyle changes we are encouraged to make. I am talking about high-potency, stimulant-based energy supplements and excessive caffeine consumption. Many seniors struggle with midday fatigue. It's normal, it's frustrating, and it leads many to reach for natural energy boosters, pre-workout powders, or even simple high-caffeine energy drinks. These products often contain ingredients like guarana, green tea extract, or concentrated anhydrous caffeine. Here is the problem. These stimulants act as direct physiological antagonists to your blood pressure medication. While your pill is working to dilate your arteries and keep your heart rate steady, these stimulants are triggering a fight-or-flight response. They cause an immediate surge in catecholamines, your body's stress hormones. This leads to rapid constriction of your blood vessels and a spike in your heart rate. Even if your blood pressure was perfectly controlled an hour ago, these stimulants can force a temporary but severe breakthrough spike that puts undue stress on your arterial walls. So what is the actionable path forward? How do you manage your health without living in a vacuum? First, the checklist protocol. Before you add anything new to your daily routine, whether it's a new vitamin, a joint supplement, or a trendy herbal tea, you must do a 60-second check. Look up the interaction on a reputable site like the NIH or your pharmacy's database, or simply ask your pharmacist, does this interact with my medication? Second, audit your cabinet. Take a physical inventory today. Remove the NSAIDs and replace them with safer alternatives approved by your doctor, such as topical creams for joint pain. Third, consistency is king. Always take your medications at the same time, with water, and away from any supplements. Fourth, listen to the quiet signs. If you feel sudden dizziness, persistent headaches, or off days after changing your habits, document it. Don't dismiss it as age. That is your body signaling a shift in chemistry. We have covered a lot of ground today, and I want to leave you with one final empowering thought. You are not a passive recipient of your health. You are the architect of it. Managing blood pressure after 60 isn't just about the prescription bottle on your nightstand. It is about the thousands of tiny, informed choices you make every single week. By removing these 4 common triggers, high-dose licorice, NSAIDs, grapefruit, and concentrated stimulants, you are doing more than just avoiding a spike. You are giving your body the space it needs to do the work it was designed to do. You are clearing the path for your medication to work as effectively as it possibly can. If you found this breakdown helpful, please do me a favor. Share this video with a friend or family member who is also navigating the world of blood pressure management. Sometimes the most valuable gift you can give someone is the knowledge that helps them avoid a silent emergency. If you want more deep dives into the science of aging with vitality, and advice that skips the jargon and gets right to the point, make sure you subscribe to this channel and tap the bell so you don't miss our next conversation. And before you go, drop a comment below and rate this video from 1 to 10. Your feedback tells me exactly what topics you need to hear about next. Thank you for trusting me with your time today. Keep advocating for yourself. I'll see you in the next one.